pandemic, as you alluding to, I think, and hinting, sheds a very bright light on a lot of the weaknesses in a society. For us, it did one of the things that you are alluding to, the deficiencies of our healthcare system. Of the variant that is dominant in the UK right now clearly has an increased capability of transmitting, and recent data from the UK indicates that although at first it was felt to not really have an increase in virulence, which means it is more likely to make you seriously ill or kill you, we're finding that that's not the case, that it does have the inherent capability of making you more sick. It does not appear to have a substantial effect at all on the efficacy of the vaccine. So we're pretty good there, but you've got to pay attention to it because it's evolving. And then a number of papers are coming out on the preprint journals that are showing that when it comes to the monoclonal antibodies, several of them are completely negated in their efficacy by the mutation, and there seems to be a considerable more threat to vaccine efficacy, even though the cushion of efficacy is sound enough that the vaccines that we're using now will be good against both the mutant in South Africa as well as in the UK. Having said that, this is an evolving situation. So what we need to do and are doing are already looking at making upgraded versions of the vaccine that could address both the South African mutant as well as the one in the UK. So even though right now the vaccines seem to be able to work against them, we need to be prepared to upgrade, and maybe even as a boost later on, or as a bivalent vaccine that goes against both the wild type and the evolving mutants. It goes very effectively from human to human. And the critical issue that we didn't realize first, that if there had been transparency, it would have profoundly influenced policies. And that is that at least half of the infections are transmitted by somebody who has no symptoms at all. There are still things that we don't know right now about the origin. Understanding the origin would really be important. And we don't know it now. It's a big black box, which is awful. We're over a year into it and we still don't appreciate it.